AccessU can do health checks, which include a general standard health check, which can cover things like your cholesterol if you're a diabetic, but can also move towards sort of fatigue and wellness health checks, as well as gut health checks, where we check a whole range of things, don't we, Aisa?
Yes, I think the general public quite often have very specific needs, and what we try to do early on is establish what it is that is causing some sort of level of anxiety or concern. I think sometimes patients find it difficult just to access their own GP to get this level of reassurance, and because we offer quite a wide variety of appointments both in sort of evenings and over the weekends, we are able to book people in. Quite often we'll have people that we have to sort of, I don't say interrogate further, but understand further what the need is, and then sometimes we will provide a tailored health check based on what their needs are. It might be that a hormonal profile is needed, it might be fatigue and wellness, or as Raj said, gut health. It might just be a standard health check and understanding things like cholesterol or pre-diabetes. Perhaps a family member might have been diagnosed recently and just wanting further reassurance.
Yes, and that can cover other ranges as well, like your vitamin D levels. It can be your thyroid function, which can contribute to tiredness if, for example, you have an underactive thyroid. So these are all the type of ranges of health checks that we can offer at AccessU.
I think with more and more presence in the media and more awareness, and certainly the NHS 5-year plan of looking at sort of preventative medicine, people are taking more and more responsibility for their own health. I think sometimes, again, usually triggered by a family member and a diagnosis, people are just wanting to understand their baseline health, and sometimes it's just about tapping in for availability for an MOT, so to speak.
With a health check, more often than not, we'll do various things which can include your blood pressure, your height and weight. It will also include blood tests. And then after that, when we get the results after a day or two, you'll often get a call from the GP or one of our other clinicians, such as a nurse, who can then explain what those conditions are and then whether we need to go do anything further in relation to it.